I'm Andrea and I will be showing you how to take a manual blood pressure. Many times we do use automated, however it's important to understand how to manually take a blood pressure in case you're ever in that position. The reason we take the blood pressure is as a dental provider we're able to screen for hypertension because some patients may come to the dentist more than they go to the doctor. In addition to that, we also screen the blood pressure because if we are delivering anesthetic and they have higher blood pressure, it can impact that. So you want to make sure that your patient has been sitting comfortably for about 5 minutes. They didn't run in from, the gym or, they are calm and rested and kind of ready. Also, you want to make sure that their legs aren't crossed and remind them of that. So we'll have our blood pressure cuff and our stethoscope. And first we'll place our blood pressure cuff on our patient. You want to make sure you're placing it above the fold in the elbow, and if they have a sweater or something, they can move the material up. On the blood pressure cuff, it has arrows that point towards the brachial artery, so you want to make sure you're putting it in the correct location. One mistake people do is they have the cuff too low, so you want to make sure that you can still see that fold. You can go ahead and relax. So in one hand, you'll have the bulb of the blood pressure cuff, and then you'll place your stethoscope on. When you're listening, you want to make sure that your stethoscope is turned correctly so that you can actually hear the readings. You're going to place the flat part here of the stethoscope over the artery and just hold that in place. While the other hand, you're going to hold the bulb and open and close the dial. So you want to make sure that it's closed all of the way, and you're going to pump up your cuff. And then we're going to listen. Slowly releasing the valve to make sure that it's dropping about 1 millimeter or 5 milligrams of mercury per second. So the reading you hear initially is going to be the systolic reading, and then as you hear it making that sound like a heartbeat sound, it'll be continuous, and when you stop hearing it, that will be your diastolic reading. When I heard it on my patient the first time, it was around 115, and it continued to go until about 75. So 115 would be my systolic reading, 75 would be my diastolic reading, and they're written as a fraction. You want to make sure your patient's blood pressure is within a normal range before you pursue treatment with using anesthetic, and you also want to note their blood pressure in the chart so that we can keep track of it each visit. Remove the cuff, record your readings, and you're good to go.